So TORS means Transoral Robotic Surgery. So it means an operation through your throat or your mouth to remove cancerous growths from your mouth. It is, in other words, a minimally invasive operation, which basically means we are not making any cut in your body. We're going through your mouth and removing the tumors or cancerous growths from your mouth using a robot. It doesn't mean the robot is doing the operation. It's I am controlling the robot. It's almost like PS2 or something like that. And I believe the next generation will be better than me in that, because obviously they are very good with the computers. And that's why the trainings are rigorous. And you control it from what we call console. Once again, I'll give you an example of PS2. You basically look down a console. You have got the joystick or the controller, and you control the robot. And it gives you a better access because of the camera you have. It's a three-dimensional camera. And it also gives you a better control of the operation because it is performed by a robot. And you can imagine it is definitely takes care of the human errors to a degree. I think the greatest benefit, number one, is it allows you to remove the growth with enough tissue to have a control of the cancer of yours. Number two, you don't have any scar in your body. It is great for the cosmetic purposes. Number three, you're avoiding the old-fashioned big operations, which involve cutting the face up, putting some extra tubes in your nose and throat, etc. And that is very important because it could be disfiguring. The old-fashioned operations are. And if necessary, it's done. But these are done for people who get cancers in, sort of early years in their life, 40s and 50s, etc. And you don't want to cause. You also can avoid giving those individuals a radiotherapy, chemotherapy treatment because they're not without side effects either. And lastly, very important, it's a minimally invasive operation. So my patients currently don't stay any more than 2 days. Whereas if you think about old-fashioned operations where you make a big cut in the mouth and neck, etc., and they stay for a couple of weeks or even longer, depending on how their swallowing is, how their breathing is. So it is, I believe, if it's done well and if it goes very well, it's significantly better than the techniques which are available which were available to us before. So the commonest procedures I carry out currently in National Health Service are for cancers or cancerous growths of your tonsils, your back of your throat, your tongue cancers, your cancers of your side of your face. Those are the common things we carry out in National Health Service. However, one must not forget the opportunities and innovations are coming. And the innovations are not very complex. So as I spoke, the tongue operation, the same tongue operation is very well tolerated and usually done for people with snoring or sleep apnea. And I'm absolutely certain they're available in the private sector. And here in Birmingham, the hospital next to Queen Elizabeth Hospital, Birmingham, is opening up, and this is going to be our private setup. And I will be aiming to do some sleep apnea or snoring operations using the robot, obviously in a select group of patients, and it will be done in a multidisciplinary setting so that we don't have any bias. We do those operations for the patients who really need that operation. And the last but not the least, there is evolution coming from Far East about robotic thyroid surgery. And again, this is still a bit slow, but I've looked at some of the videos. I'm going to train myself up in a way that we do this and we can provide this service to my patients over a period of a few years down the line when we have got the facilities available. So all in all, currently, we do it for the cancers of your throat, which is a great invention. And as I touched base, I am very keen to provide similar service for snoring and sleep apnea patients in the private hospitals. So it takes usually a couple of hours for the operation. And it's almost like as if you're having a tonsil operation. It's done through your mouth. So there is nothing more than you having a tonsil operation through your mouth. So that is the length of time. And as I said, usually you're in hospital for a couple of days. The recovery time is 2 weeks. It is in the beginning painful, and I usually tend to say to the patient, it's like a tonsillectomy. You need your painkillers, you take them on a regular basis, and basically take it easy for 2 weeks. And usually 2 weeks' time, you should be back to near normal.